all for giving up your time today to come be in the room here with us and talk about this important topic. We really want to come out at the end of the day with some actionable outcomes. So we're going to try and keep the discussion as focused as we can to think about what can we do, what are the gaps, what are our strengths, and how do we push that forward.
I've been looking at this area probably for about 19 years or so since I was diagnosed. At the time I was diagnosed, I felt that there was actually substantial evidence of a significant contribution from lifestyle to not only getting the illness but to the progression of the illness.
I am really looking forward to meeting my colleagues here in Australia and hopefully developing some collaborative partnerships as we do this very important work, looking at how diet impacts the development and progression of multiple sclerosis related symptoms.
What I'm hoping to get out of the workshop is the input of a number of my peers who are working in the same scientific area so that we can best design the kind of intervention trials that we're trying to put into practice.
I think it's just developing a better knowledge and hoping that there's a two-way benefit in terms of us learning from MS and MS learning from dementia.
I'm really excited that you're all so excited to be talking to each other. It's starting out well.
I think workshops like the one today are important because it brings together community and it helps foster interactions that may not otherwise happen. Research can be a very isolating occupation, and I think bringing people out of their silos and getting them interacting and discussing ideas is a great way to inspire future research.
It's really important to get different points of view and different disciplinary perspectives on whatever you're researching. As researchers, we talk about being siloed. That's a term that academics use, where we can often just work with our own lab group in our own discipline area, and we don't get new ideas and new perspectives. And by coming together with other people and with people who are living with the condition, it's really important to involve consumers. We get much better ideas and perspectives.
One of the complications is that we're not really sure when the disease starts, and we're not really sure when in our whole life course an exposure might be important. So it makes it really difficult to study and to pin down risk factors. For people with MS, what we really want to try and do is identify diet, physical activity, the things that people can actually do, people with MS can do, to decrease their disease, to make their quality of life, improve their quality of life, but also to actually decrease the whole sort of what's happening with their disease.
People really, really want to know what they can do for themselves to make a difference when they have a diagnosis of MS.
It's just so important that we teach people how to address and optimize diet and lifestyle.
There seems to be a strong view that people with MS can't wait, that we actually need as a group to start formulating advice about lifestyle based on the best available evidence. Now we know that might not be perfect, and really evidence generation in this area is really hard. It's hard to design trials about lifestyle change.
I'll talk about the links between a healthy diet and MS and some of the specific nutrients that are of interest.
Well, at the moment in terms of diet, the best available guidelines we have are the Australian Dietary Guidelines. Only around 4% of the population actually follow those, so it means that a lot of people with MS also probably don't follow a healthy diet. So the best thing people can do is to actually try and follow those healthy guidelines a bit more. So that includes adding fruit and vegetables to your diet. People generally don't get enough. Include oily fish in your diet a couple of times a week, and try and reduce the discretionary foods. So reduce the processed meat, the cakes and biscuits. Unfortunately, the things that people do like to eat, but just starting to reduce them can help.
Is part of this discussion today. We have a huge amount of expertise in the room. We have epidemiologists, neurologists, nurses, allied health professionals, data scientists, clinical trialists, but most importantly we also have people who live with the disease on a day-to-day basis.
The workshop today was a really good opportunity to focus down on what were the modifiable lifestyle interventions that might be possible in MS, then to understand what the evidence was, where the state of the evidence was. We brought in people from some other areas, so from general practice with a focus on modifiable risk factors for cardiovascular disease and for dementia, to try and understand the things that those fields have already done, how they might apply to MS. So it's a great opportunity to sort of really nail down what the possibilities were, where the evidence was, not just in MS but everywhere else, and where the evidence was in MS and where we need to go to improve the evidence.
There's a lot of work to do, but when we work together as a community of people with MS and scientists and clinicians, that we can really achieve those goals when we put great minds together.
For me personally, as someone living with MS, the lifestyle factors are tremendously important, and knowing what I can do to help my own health and well-being through those factors is great, but also what research we can quantify around it to make sure that other people can live well with their MS going forward.
We're all very much aware of the disease-modifying therapies, the drugs and so forth, but I guess we all figure there's probably more we can do.
MS research wants to get clear action plans of fundable research from today, this workshop, that we can go and find the financing for.
Workshops like today are really important to bring researchers from all different expertise and different areas to come together to really tease out what we need to know and what we need to research about modifiable lifestyle factors for people with MS. And I think that's what we achieved today as well.